The primary role of a phlebotomist is to A. Perform diagnostic tests. B. Collect blood samples. C. Administer medication. D. Conduct physical examinations. Answer B. The primary responsibility of a phlebotomist is to collect blood samples for laboratory testing. Which of the following characteristics is essential for a phlebotomist? A. Honesty. B. Empathy. C. Professional appearance. D. All of the above. Answer D. A phlebotomist should exhibit honesty, empathy, and maintain a professional appearance. The destruction of pathogenic microorganisms after they leave the body is known as A. Sterilization. B. Medical asepsis. C. Surgical asepsis. D. Disinfection. Answer B. Medical asepsis involves the destruction of pathogenic microorganisms after they leave the body. The function of the circulatory system is to A. Digest food. B. Deliver oxygen and nutrients to cells. C. Control movement. D. Produce hormones. Answer B. The circulatory system delivers oxygen, nutrients, and removes waste products from cells. The heart is composed of how many layers? A. 1. B. 2. C. 3. D. 4. Answer C. The heart has 3 layers: endocardium, myocardium, and epicardium. The largest artery in the body is the A. Pulmonary artery. B. Aorta. C. Vena cava. D. Coronary artery. Answer B. The aorta is the largest artery in the body, carrying oxygenated blood from the heart to the body. The first phase of hemostasis is A. Platelet phase. B. Coagulation phase. C. Fibrinolysis. D. Vascular phase. Answer D. The vascular phase is the initial reaction to blood vessel injury, causing it to constrict. Which test evaluates the intrinsic pathway of the coagulation cascade? A. Prothrombin time, PT. B. Activated partial thromboplastin time, APTT. C. Fibrinogen degradation products, FDP. D. Bleeding time, BT. Answer B. APTT is used to evaluate the intrinsic pathway of the coagulation cascade. The preferred site for venipuncture is the A. Antecubital fossa. B. Dorsal hand. C. Foot. D. Neck. Answer A. The antecubital fossa of the upper extremities is the preferred site for venipuncture. The vein of choice for venipuncture is the A. Cephalic vein. B. Basilic vein. C. Median cubital vein. D. Brachial vein. Answer C. The median cubital vein is preferred because it is large and does not tend to move. Before performing venipuncture, the site should be cleaned with A. Soap and water. B. Chlorhexidine. C. 70% isopropyl alcohol. D. Hydrogen peroxide. Answer C. The site is commonly cleaned with 70% isopropyl alcohol to reduce infection risk. The needle should be inserted at an angle of A. 5 to 10 degrees. B. 15 to 30 degrees. C. 45 degrees. D. 60 degrees. Answer B. The needle should be inserted at an angle of 15 to 30 degrees to enter the vein properly. A hematoma is most likely caused by A. Applying too much pressure. B. Leaving the tourniquet on too long. C. The needle going through the vein. D. Not using a tourniquet. Answer C. A hematoma occurs when the needle punctures through the vein, causing blood to leak into surrounding tissues. Phlebitis is A. Inflammation of a vein. B. Formation of a blood clot. C. Blood infection. D. A bruise. Answer A. Phlebitis refers to the inflammation of a vein. Quality assurance programs in phlebotomy include A. Regular audits. B. Employee training. C. Protocol reviews. D. All of the above. Answer, D. Quality assurance programs involve audits, training, and protocol reviews to ensure high standards. Fasting specimens require the patient to abstain from food for A. 6 hours. B. 8 hours. C. 10 hours. D. 12 hours. Answer, D. Fasting specimens typically require the patient to abstain from food for 12 hours. Therapeutic drug monitoring involves A. Checking blood glucose levels. B. Monitoring medication levels. C. Testing for infections. D. Evaluating kidney function. Answer, B. Therapeutic drug monitoring ensures the correct levels of medication are maintained in the blood. Which specimens must be kept warm after collection? A. Blood cultures. B. Cold agglutinins. C. Coagulation tests. D. Serum chemistries. Answer, B. Cold agglutinins must be kept warm to prevent antibodies from attaching to red blood cells. Light-sensitive specimens include A. Blood cultures. B. Bilirubin. C. Glucose. D. Hemoglobin. Answer, B. Bilirubin and some vitamins are light-sensitive and should be protected from light exposure. The recommended site for a heel puncture in infants is A. The arch of the foot. B. The middle of the heel. C. The medial and lateral plantar surfaces. D. The back of the heel. Answer, C. The medial and lateral plantar surfaces of the heel are recommended for dermal punctures in infants. For dermal punctures in adults, the puncture should be made on A. The thumb. B. The index finger. C. The middle or ring finger. D. The pinky finger. Answer, C. The middle or ring finger of the non-dominant hand is recommended for dermal punctures in adults. The correct order of draw for blood collection is A. Blood culture, light blue, red, green, lavender, gray. B. Red, light blue, green, lavender, gray, blood culture. C. Light blue, red, green, lavender, gray, blood culture. D. Green, red, light blue, gray, lavender, blood culture. Answer, A. The correct order of draw helps prevent cross-contamination and ensures accurate test results. Which additive is found in a lavender top tube? A. Sodium citrate. B. Heparin. C. EDTA. D. Potassium oxalate. Answer, C. Lavender top tubes contain EDTA, an anticoagulant used for hematology tests. Gray top tubes are used for A. Coagulation studies. B. Blood cultures. C. Glucose testing. D. Serum chemistries. Answer, C. Gray top tubes are used for glucose testing as they contain an antiglycolytic agent. The Occupational Safety and Health Administration, OSHA, is responsible for A. Patient care standards. B. Lab test results. C. Workplace safety regulations. D. Medical billing codes. Answer, C. OSHA sets and enforces standards to ensure safe and healthful working conditions. The most important step to prevent the spread of infection is A. Wearing gloves. B. Hand washing. C. Using disinfectants. D. Wearing a mask. Answer, B. Hand washing is the most effective way to prevent the spread of infection. The first step in controlling external hemorrhage is to A. Apply a tourniquet. B. Elevate the affected part. C. Apply direct pressure. D. Call for help. Answer, C. Applying direct pressure is the most effective way to control external bleeding. Signs of shock include A. Warm, flushed skin. B. Rapid, weak pulse. C. Slow, strong pulse. D. High blood pressure. Answer, B. Shock is characterized by a rapid, weak pulse and other symptoms like pale, cold, clammy skin. The first link in the chain of infection is A. Mode of transmission. B. Portal of entry. C. Susceptible host. D. Infectious agent. Answer, D. The chain of infection begins with the infectious agent, which can cause disease. Standard precautions apply to A. Only patients known to have infections. B. All patients, regardless of diagnosis. C. Only patients in isolation. D. Only patients with blood-borne infections. Answer, B. Standard precautions apply to all patients to prevent the spread of infections.